When it comes to alcohol and fertility, the focus is quite often on the women. We all know about its harmful effect it has during pregnancy. But is drinking alcohol before conception harmful? Does it have an impact on the male fertility? Should we even worry about it? Is it a big deal? Yes, it is. Hello everyone, myself Dr. Indu from Samrudh Fertility and Urology Center. Do you agree that alcohol is a widely used recreational substance all around the world, especially in the reproductive age group? And it is extremely important that one knows about its deleterious effect it has on human reproduction. Social drinking is quite a norm these days, especially over a weekend, for any celebrations, festivals, or it could be any conferences. But what matters is the amount of alcohol one consumes. If someone drinks occasionally or minimal, then it hardly has any impact on one's health. But don't be relaxed. If you are somebody who is consuming in moderation, then it can affect your overall health, including the sexual health. When it comes to heavy drinking, it has got a lot of bad health effects affecting every system of the body. Heavy drinking is defined as one who consumes more than 5 drinks in a span of 2 hours, or somebody who has more than 14 drinks in a week. Amongst the many ill effects of alcohol, erectile dysfunction is one such side effect that can compromise the fertility to a great extent. What is erectile dysfunction? It is inability to get or maintain erection that is enough to perform intercourse. And this is a complex process which requires a good coordination amongst the brain, hormones, blood vessels and nerves. Recent studies have revealed that men who binge drink has the risk of erectile dysfunction of up to 30%. In my so many years of experience, I have seen men who consume alcohol either occasionally or over weekend. Somebody who consumes heavily, I have not come across, and I wonder if I get the history right. Today, I will be addressing this topic of how men with erectile dysfunction, especially that is associated with alcohol consumption. Allow me to share 5 different reasons of how alcohol can cause erection issues. So let's dive right into the topic. Reason number 1. Alcohol acts like a depressant. It slows down the functioning of the central nervous system. It weakens the signal that travels from brain to the various parts of the body. It makes the motor skills and coordination suffer, and overall it impacts the signal that travel from brain to the penis, resulting into difficulty in achieving and maintaining erection. Reason number 2 is hormone imbalance. Alcohol can really mess up with your entire endocrine system. It not only impacts the reproductive system, but it can also come in the way of thyroid functioning. It can disturb the adrenal functioning. Adrenal glands are a tiny gland that sit on the top of the kidney, which are responsible for stress management and fluid level management. It can also come in the way of insulin regulation. So if we look into the reproductive aspect, then it reduces the testosterone level. This is the male hormone, and it also leads to reduced sex drive, and gradually it can also reduce the size of the testis. So you can see all this can cause erection issues. Reason number 3 is alcohol causes dehydration. This means you will be urinating more frequently than usual, and this will result into dehydration. When you are dehydrated, the blood volume reduces, the blood flowing to the penis decreases, and this makes the erection harder. This is another explanation how erection can get affected because of alcohol. Reason number 4 is performance anxiety. Alcohol can give you that confidence boost initially, but overindulgence can actually increase your anxiety. Now, what happens when anxiety sets in? The stress hormone gets released. This stress hormone causes increase in the heartbeat, increase in the blood pressure, increase in the blood sugar levels. It affects the immune system, weakens the immune system. It also weakens the blood vessels. So when this is happening more often, then performance anxiety sets in, and this would be like a one-way ticket to the issues, to the problem of erection dysfunction. And this can eventually also impact your conception chances. Reason number 5 is alcohol can cause disruption of the body's internal clock or the biological clock. This biological clock is needed to regulate the body's physical and the mental system and bring harmony amongst the major body functions such as metabolism, immunity, sleep cycles, energy levels, cognitive functions or memory functions, reproductive functions, digestive functions, and so on. Alcohol can have a negative impact on all this and will cause one to have reduced sleep, lower energy levels, lower sex drive. All this will have an impact on one's ability to have sex and also can cause erectile dysfunction. So friends, these were the 5 different reasons of how alcohol can impact erection, cause erection issues. Did I scare you? I think I did not. I empowered you. I want you to take control of your mind, body and reproduction. So now, don't panic if you take an occasional drink. It's okay. It's all about moderation. But remember, if you need help, don't hesitate to reach out to the healthcare professional. So before I wrap up, I want to tell you that alcohol can act like a cell killer if it is consumed in heavy amount, but it can also act like a cell healer if it is consumed occasionally or less often. So if you like this video, please share with the ones who need it. And if you have any topics that I want to talk on, do leave it in the comment section. It really helps us to bring you with more valuable content. Thank you for watching and see you soon with my next informative video. Bye for now.